Welcome to another episode of the program, Easy Access to Healthcare for All, a program that brings you news and happenings of the National Health Insurance Authority and the health insurance space as it pursues its mandate to attain universal health coverage by 2030. One key yardstick in ensuring satisfaction is when there are checks and balances in the health insurance sector. The National Health Insurance Authority is very aware of this fact and makes adequate provision to allow for it. Through its enforcement department, stakeholders and enrollees can complain or seek redressal when not satisfied with services rendered in the processes of healthcare provision. In this episode of Easy Access to Healthcare for All, we bring you an interview with Dr. Habib Abdulhamid, Head, Healthcare Facilities Division, where he speaks on some activities of the Enforcement Department in the NHIA and how they help in providing checks and balances in the health insurance ecosystem. My name is Aisha Muhammad Ahmed, your anchor. I will be back shortly.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, NHIA holds training for extended management staff, just as Nigeria Employers Consultative Association (NECA) visit NHIA headquarters.
The NHIA organized a two-day internal capacity training for extended top management staff of the authority. This was on Wednesday, 14th September 2022. The training was to discuss fundamental principles as enshrined in public service rule.
Human Resource has...
Professor Mohammed Nasir Sambo, Director General of the NHIA, said the training became necessary due to some matters arising, which warrants leadership's attention.
I realized over time that the level of knowledge or procedure of discipline in the organization is lacking, and more so at the level of states. Staff are doing whatever they like without bringing them to order. Crux of the matter is some even state coordinators are not conversant on the procedure of assuring discipline in an organization. So I wouldn't want to take things by chance. So I decided to bring all the top management, as well as zonal coordinators, and brought two resource persons, one from the Office of the Head of Service, one from the Human Resource from the Ministry of Health. During our last meeting, they demonstrated to have a very good knowledge on the issue of disciplinary cases. So the event of today is to try to bring the staff up to the responsibility of these disciplinary cases.
Also speaking at the training, Sani Garba, General Manager, Human Resources, said the training was an effort by leadership to bring staff up to date on issues like discipline, promotion, among others.
This program is part of the continued effort by the current management of the National Health Insurance Authority in terms of building capacity and empowering staff to do what is expected of them at any material point in time. The circumstance and the rationale behind this particular one is to acquaint all the management staff and their deputies, alongside all the human resource department staff and the legal unit department staff, to acquaint themselves with what it entails as far as public service rule and the guidelines for appointment, promotion, and discipline being released from time to time by the Office of the Head of Civil Service Operation for the service-wide and other MDS to ensure that staff are being properly guided, properly educated and enlightened on what are expected of them in terms of their conduct, ethics, behavior, and how they go about carrying out their responsibilities for the best interest of the organization that they serve.
Participants shared their thoughts on the training.
They help a lot in instilling discipline amongst workers. And again, we're learning the procedures as encapsulated in the public service rules. So the various procedures to deploy in instilling discipline and disciplinary actions. Because, when you get it wrong, it usually ends up in litigation. We've had series of cases in that regard. So by the time we take the steps as they should, and the procedures, follow the procedures as provided in the public service rules, I think it will be easier to deal with employees.
As a human resource personnel, we all need this procedure. We need to do it to do our day-to-day activities, because that's what we do every day. Any disciplinary cases that come to the authority, it comes to the HR, and it's the HR personnel that treat it. So if we don't know how to do it, there is no way we can do it. We don't know how to do it. It's not just about doing it, it's doing it the right way.
Thank you very much, for your frankness.
A delegation from the Nigerian Employers Consultative Association, NECA, recently paid a courtesy visit to the NHIA corporate office in Abuja. The team was led by Mr. Adewale Oyerinde, Director General NECA, and was received by members of the management team of the NHIA. Mr. Adewale Oyerinde, while speaking, congratulated the authority on its new act. He said the visit was to deepen the existing partnership between both agencies, adding that NECA has a capacity to encourage compliance with the new act.
Our visit is not to share problems or to discuss problems, to discuss issues, even though those issues they are there. But first is to familiarize our team, the new secretariat team, familiarize with you, and also extend our hands of collaboration to the authority, that we are ready to partner with the authority to address all the issues that we have concerning within the space of health insurance scheme in Nigeria.
In his response, Professor Mohammed Nasir Sambo pledged continuous partnership with NECA, considering its contribution to the NHIA in the past. Sambo said the partnership will play an integral part considering the mandatory nature of the NHIA Act.
The partnership between NHIA and NECA is not a new thing. It's an old one. It's as old as NHIA itself. And recognizing the tremendous role of NECA in driving the economy of Nigeria, it will help a lot. It will help NHIA a lot to continue to partner with it. More especially now that the mandatory social health insurance bill is signed into law.
Professor Sambo further added that all stakeholders within the health insurance ecosystem are being carried along in the implementation of the Act.
The program is easy access to healthcare for all. The Enforcement Department is a medium that attends to both enrollees and stakeholders' complaints. Our next segment, Issues Around the NHIA, will bring you more details of activities of the Enforcement Department as it relates to redressals and complaints handling within the health insurance ecosystem. Do keep watching.
The NHIA is the foremost agency in implementing social health insurance in Nigeria. It is intended to be the veritable vehicle through which Nigeria can attain universal health coverage. The authority functions in a tripartite manner: the NHIA, healthcare facilities, and the health maintenance organizations, all working towards the same goal. The authority monitors compliance of stakeholders through its enforcement department, which also carries out other duties. In an interview, Dr. Habib Abdulhamid, Deputy General Manager and Head Health Services Division, gives us an insight into the enforcement department.
The enforcement department is that saddled with the responsibility of ensuring that all critical stakeholders conform with or adhere to the NHIA Act, the operational guidelines, or other extant rules and regulations of the authority. And in so doing that, we carry out three main activities. Complaint handling, which is the majority, about 70% of the activities we do have to do with complaint handling. Then secondly, compliance monitoring and assessment. And then thirdly, resolution of disputes that arise between stakeholders in the course of the discharge of their roles and obligations.
Dr. Habib explains more on complaint handling.
We receive these complaints, we collate them, we do the eligibility sorting, and then the investigation proper. And then the investigation could take a lot of form. In a lot of cases, we do what we call desk review. You know, you write, you notify the respondent that, okay, we have so information about you. We do that through what we call the notification of allegation form, you know, and then we get a response. So people say it, they do a desk review of all the submissions to reach a resolution. Then the resolution usually will be either that a breach occurred or there was no breach. And in cases where the breach occurs, then it moves on to what we call the sanction management. So in line with Section 7, offenses and penalties of the present operational guideline, then that the respondent who has been found guilty, you know, will be sanctioned in that line.
Enrollees are the end users of the scheme. However, sometimes they are not satisfied with services rendered. How do they seek redress?
For the enrollee, their first port of call should even be the HMO. So enrollees are supposed to know their HMOs, have their contact numbers or their emails. So it's when they have made that report and then they do not get any satisfactory response, then they can report to the authority. And we say that enrollees reside in the state, their facilities are in the state they reside, and then NHIA has offices in all of the states, so they should walk to the state office as a walk-in or in person to make their complaint, or they could call. Most of the state offices also have numbers that people could call, or they could write to the state coordinator or through their email. So when they do that, like I mentioned earlier, there's a request for intervention form, and this form contains a section where they ask them for all of the documents that will ease the investigation officer's work. So in that case, they may be asking for receipts of payments, you know, any other evidence that will surely show that, oh, I went to this facility and I paid for something. So if they paid for something, then they will certainly have a receipt for that payment. So that's one of the things that whoever is investigating will be asking for.
For the NHIA, its redress mechanism is not just in name. Some enrollees have had to seek redress and their issues addressed. Some of them speak.
My wife was sick, so she was pregnant. So I took her. I was registered in one of the government hospitals, and they were on strike at that moment. So we needed to refer her because she had some little complications. So we were referred to a good hospital close by, which we did, and they took us and they were treating us nice, and we are okay. We are happy about the hospital. But towards delivery for my wife, we discovered that the hospital was they were primary care providers and not secondary care providers. So we were actually supposed to be referred. The doctor was actually supposed to refer us to another hospital to perform the surgery, because my wife was supposed to go for surgery because she couldn't give birth through the formal way. So the doctor actually performed the surgery and we paid for the surgery. So he told me before he did it that it wasn't covered, which I called my HMO. My HMO tried to talk to him, but he said it was an emergency. I'm not a doctor, so I wouldn't know what was an emergency. So he did what he thought was best for me. So my wife delivered safely. Everything was fine, well treated, no complications. Then I asked him if I could seek redress. So he said, of course I could. I think at that time he did not understand how the redress was going to look like. And I had to actually seek redress to my office. My office referred me to NHIS. On getting to NHIA did a fantastic job. They did a proper follow-up and actually wanted to back down on it, but they said no, that a complaint has been made. They needed to correct certain things and all that. Anyway, as God will have it, I was able to be given redress. I was paid back my money, and I'm at peace with the doctor. We have no issue.
Sometime in June, I was sick. I went to hospital. I'm on NHIS. I got there. They gave me this. I saw that they struck my folder. I asked why. No, they could not give me any reasonable answer. But because of the way I was feeling that day, I have to fill the form and see doctor. After seeing the doctor, they said I should run tests. They say 4,000. I say, why am I on NHIS? They say they don't understand. They say they should treat me private. I say, why? They say they don't know. Because of the way I was feeling, I have to run the test, see the doctor. Coming to prescribe drugs for me, they wrote 23,000. I said, well, I don't have such money. They say, yeah, I'm on private. So that now prompts me after 2-3 days that I've at least recovered it. I paid. They gave me receipt. And I said, let me go to an NHS office and find out whether they have changed me without me knowing. Because I did not go to hospital. I'm not going to NHS hospital to change. I got there, they checked their system. My name was still in the hospital. Then I said, what happened? I told them the story that, see my receipt, see how much I've paid. I paid like 27,000. They said, I'm not on longer in NHS. My name is still in the hospital. They now took the case upon them. They say, I dropped my particulars and they said they will call me. I left. After a few days, I got called from the hospital that the NHS has called them. I went. Then they will now say, it's a mistake from their side. They are not supposed to. I said, oh, I've used this hospital for years. I don't know why this mistake will just come overnight. They now refund me the money that I've spent. Even when one of my neighbors said it will take 3 months, to my greatest surprise, under a few weeks, they were able to resolve my issue and I was refunded.
For your frankness, we just put it.
In line with the provisions of the Act for a complaint handling mechanism to serve Nigerians adequately better, the NHIA organized a 2-day meeting on complaints handling experience sharing with related regulatory agencies. There were several presentations from agencies that shaped the outcome of the meeting.
Welcome back. Today on our Stakeholders segment, we will bring you interview with participants of the two-day meeting on complaints handling and experience sharing with regulatory agencies. Pharmacist Ghali Muhammad said, it is to help the NHIA build a good complaint handling mechanism and to serve stakeholders better.
We already have, under NHIS then, we have a complaint mechanism. But because of the added responsibilities of the NHIA Act 2022, now we need to expand that provision and that system of handling the mechanism to cover other responsibilities, especially the other external stakeholders that will not be involved. So it is in the light of that we feel that than us to sit down internally and amend, let's have an opportunity where we'll interact with other similar regulatory agencies so that we can tap from their own experience, from how they have been practicing.
Ngozi Agnes Hari says the aim of the meeting is achieved from the knowledge shared by agencies present.
It is actually meeting our aim. In organizing this program, one of the things we thought about was we want to be able to offer our enrollees and stakeholders best practices in complaints management and grievance redress. And you will know before now that we are under the NHIS, which is specifically for the formal sector, organized private sector, and those who are willing to join the scheme. But with the NHIA Act coming up, it's important that we develop the capacity to be able to deal with complaints from all stakeholders in Nigeria.
Stakeholders also applauded the NHIA for putting the workshop together.
I think it's a very good perspective because as the act is just coming into play, it is a good thing to share experiences with other agencies. It would help their health insurance scheme. It would also help the other agencies to see where they have gaps in the complaints treatment mechanisms, and it's a welcome idea.
Bringing stakeholders together to share their experience on how they receive complaints and how they handle it, I think it's a way of them gathering what I can call organizational knowledge so that they can use for them to be able to handle their own internal activity as regards complaints handling and resolution.
Participants of the two-day meeting giving us their perspective of the workshop. Up next, your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: if I am single, can my children benefit from my contributions?
Definitely. Your children, once they are biological, it doesn't matter. I mean, we don't decide whether you are married or single. The basis is that you are actually a contributor under the health insurance system, and we can verify that the children that you are registering are your biological children, or whether biological or adopted, as long as we have proof that they are your children.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
And so we draw the curtains on this week's episode of the program. Please make sure you visit any state office for complaints or redressal on issues encountered in the course of accessing care. See you next week.